Let me tell you something. Patients don't know, and doctors live with every day. You get a $30,000 hospital bill, and you assume the doctor made a fortune. Is the reality. Out of the $30,000, the doctor may get $1,100. I know this because I've lived both worlds, hospital employed and independent practice. Same work, very different truth. So where does the $30,000 go? Look around the hospital. Marble floors, designer offices, executive suites, administrative layers, billing department bigger than a clinical team. At the same time, nurses stretched thin, CNAs covering way too many patients, doctors runnings nonstop, patient waiting 12, 15, even 24 hours in the ER. That contrast should bother you. When administration starts making decisions about your health, there is a huge problem. It isn't because administrators are bad people. No, they are human. People naturally invest in what's around them. Their offices, their departments, their metrics, not what across the hallway from them. Listen to this. When something critical happens at night or on the weekend, we often have to call entire teams from home. Why aren't they already in the hospital? Because staffing costs money and hospitals want to meet the budget. I understand budgets, but when the bill is $30,000, the question becomes unavoidable. Where is the money going? It's not going to the bedside, the staffing, I'm sure about it. Let me tell you a secret about residents and trainees. Residents are smart kids, hard-working, dedicated, physician in training. They are essential to care. But here's the truth no one says. They are also a great business for hospital. Residents are underpaid, overworked, counted as a staffing. This is the best one. Billed to patients as full professional care. Yes, they are learning, but the hospital charges the patient as if a fully paid physician is providing the care. That margin does not go to the resident. It does not go to nurses. It does not go to the supervising surgeon. It doesn't go to the patients either. Again, where is the money going? Here's the core truth. Patients need doctors, surgeons, anesthesia, nurses, skilled staff. They do not need an ever-expanding administrative empire. And the biggest irony, the most skilled, accountable person in the room, the doctor holding the knife, does not explain the $30,000 bill. The building does. Why? The system rewards ownership of infrastructure, not ownership of outcomes. I'm not blaming individuals. I'm sounding the alarm. This is not burnout. It's a moral injury. This is Dr. Ben Mamer. Hit follow to help build momentum to fix healthcare in America. And let me know what stood out, because your perspectives helps me refine this message and move the conversation forward.